40-year-old male with DeQuervain's Tenosynovitis going on for a couple of months. We're going to go ahead and do an ultrasound guided injection.
Here we're going to go over anatomy for this DeQuervain's Tenosynovitis injection. Here we're looking at the radial aspect of the wrist, and you can appreciate the abductor pollicis longus muscle, as well as the extensor pollicis brevis muscle, as well as the extensor digitorum muscle and the extensor digiti mimini muscle as well. Now you can appreciate the extensor carpio-ulnaris muscle. You can appreciate the palmar carpal ligament, which is continuous essentially with the extensor retinaculum. You can appreciate some of the hypothenar and thenar musculature. And here we're looking at the palm. You can see the palmaris longus tendon, which is over the palmar carpal ligament. And now we're looking at the radial aspect of the wrist again. You can appreciate the superficial branch of the radial nerve. And here is our probe and needle. We are in a in-plane approach. We're basically in a radial coronal type plane with the ultrasound probe, and we're going to go from a proximal to distal direction into the first extensor tendon sheath. Here we're going to go over cross-sectional anatomy, focusing on the extensor compartment of the hand and the forearm. Here you can appreciate the extensor tendons as we're going proximally. Here we are basically over the mid-wrist going towards the forearm, and now we're moving up the forearm. You can appreciate the interosseous membrane as well as the tendons and muscles of the extensor aspect of the forearm. And here we are even more proximal going towards the elbow. Here we're going to look at the forearm in sagittal cuts. Here we're just going through quickly, and now we're going to go through the anatomy bit by bit. Here we are at the very radial aspect of the forearm, and you can see the musculature without any cuts. And now we're just going a little bit ulnar, and you can appreciate the layering of the abductor pollicis longus and the extensor pollicis brevis. Here we're going a bit further ulnar. You can appreciate the radial lunate articulation and the lunate capitate articulation, and yet further we can see essentially just the ulna. You can see the triquetrum and the hamate as well as the pisiform. Here we are looking at the radial aspect of the wrist in an axial plane. You can appreciate a moderate tenosynovitis here, the first extensor compartment, with some dark hypoechoic signal surrounding the tendons. And here is actually a fairly severe amount of tenosynovitis surrounding the extensor tendons, where there appears to be a mixture of synovitis and actual fluid surrounding the tendons. So here we are starting the injection. This is an in-plane approach going from proximal to distal. You can see the needle on the very upper right corner of the screen, and we're essentially just trying to get the tip of the needle right on top of the tendon. We don't want to do an intratendinous injection. We just want to essentially bathe the surface of the tendons with the cortisone. And here you can see that needle tip again, and you can see the injectate essentially surrounding the tendon superficially. You can also appreciate the injectate traveling distally over the tendon sheath.